This is Dr. Leonard with Central Ohio Spine and Joint. Today we're going to talk about a really basic kind of self-care or mobilization that you can do at home if you're suffering from like one-sided low back pain. And I'm going to talk about where we typically see the pain coming from. So there's a muscle that starts at the top of the pelvis here and attaches to the bottom of the ribs called the QL muscle or the quadratus lumborum muscle. It controls kind of lateral flexion of the pelvis and spine and helps stabilize this area. Unfortunately, what can happen a lot of times is this muscle can kind of go into a little bit of spasm, become hypertonic, or even have some trigger points in it. And it can cause pain directly in this area. So the tool that we're going to use is a lacrosse ball. It can also be done with potentially a golf ball, maybe a softball, but honestly, a lacrosse ball is the best for this. We're going to show you on one of our patients over here real fast, but essentially, this ball is going to go right into that muscle, and we're going to use your breath as a way to try to mobilize the tissue around the ball. So we're going to flip over here. I'm going to kind of show you where exactly we typically will see the pain. So base of his pelvis or top of his pelvis is right here. Top of the ribs are here. And that QL muscle kind of runs right in this area on either side, okay? Again, it kind of controls lateral flexion of the pelvis. So what we're going to do is we're going to use that lacrosse ball right into the low back here while he's laying down. So I just want you to envision where exactly that ball is when he goes and lays down. So go ahead and lay down, Chris. Okay, so we're going to slide the ball kind of right into that spot. Go ahead and lay back. Good. So he's going to take in some big, deep kind of belly breaths. I want him to think about like he's trying to breathe in and expand into that lacrosse ball. And what he can feel is when he breathes in, it creates a lot of pressure into the QL, which is doing a nice deep kind of stretch on the tissue itself. So we typically recommend our patients would do this up to about 2 to 3 times a day. You can just do it for about a minute at a time. There's really no sets or reps for it. But if you have that unilateral or one-sided low back pain kind of right above the pelvis, this would be a great exercise to try at home.